Here are a few tips to make using the pelvic harness much easier. There's a right and left pad. The left pad has the male end. The male end, or the left pad, is the pad that slides to make the harness smaller or larger for a patient. So, left pad slides away from the right pad to make the harness larger for a patient. The right-sided pad, the pad with the female clip here, does not move. So the easiest way to put the harness on a patient is with the patient in a standing position and with their help. Give them one side of the harness and let them put it behind their back. And then check to see if you've guessed correctly on the distance the pads are from each other. Whether or not they cover the innominate on either side, which these ones do. When you have the harness in a position that you like, that you think is going to hold for the patient's body type, ask them to hold the leather sides for you while you clip the buckles and draw them tightly across the waist. Once you have the buckles on the patient, you can give it a little tug to make sure it's going to sit where it's supposed to, and from there you can have them move into the position that you'd like to treat them in. Alternatively, you can place the harness on a patient in the supine position by asking them to bend their knees and lift their hips up while you place the pads underneath them. Please lay back down. Like in standing, check to see if you have the pads in the correct position before buckling. Lift again, please, and back down. When you have the pads where you want them, buckle and tighten, and move on to the treatment of your choice.